Hello, my name is Jessica Bate and I'm one of the consultant paediatric oncologists in Southampton and CCLG member. We understand that the coronavirus pandemic is causing a huge amount of anxiety and worry, especially for families with children with cancer. Here at the CCLG, we're working with all the treating centres in order to deliver the best and safest care for your child. In this short video, I'm going to be answering some of the questions families have asked us and also talk about some of the changes that you might be seeing in your centre during the pandemic. What is the risk of coronavirus to my child who's undergoing cancer treatment? Children and young people undergoing cancer treatment have a weakened immune system, which makes it harder for their body to fight infections such as COVID-19, in the same way as seasonal flu. It is very important that children and their families follow the strict isolation and precautions where possible. However, data from Italy and China and other parts of Europe have shown so far that children with cancer do not seem to be severely affected by COVID-19. To date in the UK, we have not had any cases of severe coronavirus in children undergoing cancer treatment. What about other patients with coronavirus in our hospital? Will they pose a risk to my child? All testing of suspected coronavirus patients is carried out in line with strict regulations in each hospital. All suspected and proven cases are kept away from general public areas of the hospital and returned home in isolation. Any equipment that comes into contact with suspected or proven cases is thoroughly cleaned as appropriate, so they should not pose a risk to your child. Why does my centre even need to make any changes? Centres are planning ahead for staff shortages. We know that specialist staff are required to deliver chemotherapy and to look after your child with side effects of chemotherapy. However, these staff may themselves get unwell, need to isolate, and we may need to change the fact that community teams may not be able to visit the home if someone in the home is unwell. Furthermore, some of our staff from oncology wards are being deployed to work in other areas of the hospital. How will my child's treatment be affected during the COVID-19 pandemic? During the coming months, we expect some real challenges in our ability to deliver services in the way that we're used to doing. Each centre will aim to reduce the number of visits and the time you spend at hospital while continuing to give treatment in a safe way as possible. Some of the changes you might expect to see in your centre will include restriction of visitors to one parent with no grandparents or siblings allowed to visit, telephone or video consultations rather than face-to-face visits, change in frequency of some medications, rescheduling of scan dates, and changes in the frequency of assessments such as heart scans and kidney tests. If you have any questions about any of the changes taking place in your centre, please speak to a member of your treating team. My child is in a clinical trial. How might this be affected by the COVID-19 pandemic? For children and young people already receiving treatment within a clinical trial, the plan will be to continue where possible and to reassess the situation frequently. Some centres have temporarily stopped recruiting to some or all of their clinical trials until further notice. The main purpose of these difficult decisions is to ensure that all patients receive the best possible care available and those that are already on trials can continue. Decisions will need to be made on a case-by-case basis by your own treating teams. If we do need to come to hospital as an outpatient or to stay, what should we do? We know that families who have children with cancer are already excellent at infection prevention with regular hand washing and undertaking isolation measures already. However, some general advice for coming to hospital also includes: please use the stairs instead of the lift where possible. Wash your hands frequently and use hand sanitizers before entering and leaving the bed space. Avoid touching surfaces, particularly metal surfaces, where possible, such as door handles and stair rails. Only one carer where possible should accompany your child. Siblings and grandparents should avoid coming to hospital. Although it is hard, please try not to allow your child to mingle with other children and do not mingle with other parents or carers. Any necessary face-to-face contact should be at a 2-metre distance. Most centres have had to close their schoolrooms and playrooms, so try and use the internet to stay in touch with other patients and families on the ward. For those that do need to stay in hospital, please keep your rooms as clutter-free as possible so that we can keep surfaces as clean as we can. Should my child continue taking oral chemotherapy? It is not recommended to stop or change your child's chemotherapy during the pandemic to reduce the risk of neutropenia or for any other reason. If you have any questions about what treatment your child should be having, please speak to your treating team. Will the supply of my child's medications be affected by COVID-19? The NHS has been looking carefully at its supply chains to ensure there is a secure supply of necessary drugs. There is an action plan in place to manage the supply of the medicines in the UK. Currently, there are no shortages linked to coronavirus, and no drug manufacturers have said that they expect problems due to the pandemic. However, this may change, and your treating team will inform you if this is the case. What should I do if I'm worried or have more questions? It is really important in this challenging time that families continue to access the amazing support teams, even though they may not be visible on the ward in the same way. So psychologists, occupational therapists, our social workers are all still available to help. And please speak to a member of staff to tell you how best to access them. Finally, CCLG are working with all centres in the UK to continue to deliver the best care possible for your child despite these challenging and unprecedented circumstances. We will update our guidance online as soon as new information is available, so please bookmark the link below. At this time, we should all be taking steps to minimise interaction between people in order to reduce the transmission of coronavirus, and this includes in the hospital setting. Please bear with us when we make necessary changes to our services to enable us to continue to deliver the best and safest care for your child.